Well, once again, more than half of the new COVID-19 cases are in Gauteng. After more than 12,000 new infections reported, over 8,000 are here in the province. I'm now joined by Dr. Jinal Bhiman from the National Institute for Communicable Diseases. Doctor, thanks for your time. We appreciate it. Our focus for this discussion is on the Delta variant because the President said it's sweeping through the country. Let's talk about just how contagious this variant is compared to the Beta variant, which was first discovered in South Africa.
Good evening. Thank you for having me on the show. So some original preliminary, perhaps, data from the UK actually suggests that if you do a comparison between the Beta variant and what was previously circulating in 2020, the Beta variant was about 25% more transmissible. Now, if you do that same comparison with the Delta variant to the original, it's about 97% more transmissible. So quite significantly different in terms of its transmissibility.
Wow, that is actually astounding and very scary, right? Because that means that the chances of getting infected just by being next to someone is significantly higher than the Beta variant. So is it safe to say from what you're finding that the majority of the cases in South Africa are people being infected by the Delta variant?
So let me put it into perspective. The sequencing data that we do have always lags behind. Unfortunately, in terms of getting samples delivered to the lab, from testing labs, and then actually performing the sequencing, there's always going to be a delay. So at present, we only have sequencing data from about 3 weeks ago. And at that point in time, the Delta variant was not the dominant variant in Gauteng. There was about 30% to 40% Delta variant, and then about 30% Beta variant, a little bit of the Alpha variant, and then some other non-variants of concern.
Yeah, obviously, so in 3 weeks from now, you'll be able to tell us whether or not what we're seeing now is actually the Delta variant. So let's talk about the symptoms.
We're hoping sooner.
Yeah, hopefully. Let's talk about the symptoms. I know we know what the symptoms are for the coronavirus, but is there anything different with this Delta variant that people should be watching out for, where previously you would say, actually, it's not the coronavirus? Because we would easily go through the process of elimination, wouldn't we, in terms of our symptoms? What's different now?
So there have been very few anecdotal reports of differences in symptoms. This is not generalizable. I think for the most part, in South Africa, as in most other places globally, a large proportion of people infected are asymptomatic, so they don't have any symptoms at all. And those who do have symptoms, from the limited data that we have thus far, it's not generally different.
But what about kids? Because the President mentioned that children are now falling ill because of this variant. Is that correct?
Yeah. So he did mention that, and I'm not exactly sure which reference he got that data from. I think there was some initial analyses done looking at whether there's a difference in terms of whether this Delta variant is disproportionately affecting children. That doesn't seem to be the case, especially when you factor in that the elderly population and older age groups are those who are likely to have been infected in wave 1 and wave 2 in South Africa. And so that means that right now, children are the younger age groups are the more susceptible age groups. So I think the problem is that there are too many confounding contributing factors surrounding that. To date, there is no data, there's no studies that actually show that there is kind of disproportionate affecting of this virus affecting, or this variant affecting children.
Yeah, and we know that at least 2.7 million people have received a dose of a COVID-19 vaccine. It's the Johnson & Johnson and Pfizer vaccines currently being used in South Africa. Do we know if there's any protection against the Delta variant for those who have had those vaccines?
So we don't yet have good enough data in terms of the Johnson & Johnson and how it responds to this variant and how it protects from infection or severe illness from this variant. But the Pfizer, following 2 doses, has 96 protection from severe hospitalization when somebody's infected with the Delta variant.
All right, that's good to hear. Thank you so much for your time and your insight. We do appreciate it. That was Dr. Jinal Bhiman from the National Institute for Communicable Diseases.